At what point is cost considered? Do you have that conversation with the patient?
That's a great question, and the answer to that is, in the vast majority of cases, no. And I think part of that problem is many of the primary care docs are employed physicians simply because it's pretty tough to survive as an independent in the primary care field. It does happen to be the lowest paid field of all the physicians. So not only is it difficult to get folks in, it's difficult to get folks with diversity in. But because of that nuance on the financial side, most of them are employed. And what happens in an employed situation is you have mandates in regards to how many folks that you need to see on a daily basis. You have these exorbitant panels of 2,500 to 3,500 patients, of which you can't possibly care for. Access is a problem. But when they do come in and they need something, you are so forced on the time side. Typically they have multiple medical conditions, they have more than one complaint. So you simply serve as a triage center, and you refer those to the specialists who are also employed, because if you refer them out of the hospital system, you get a knock on the door because they have electronic medical records, so they know exactly where these people are going. And you get a knock on the door wondering, hey, why did you send so-and-so to somebody outside of our network? So in essence, it increases cost. It increases either the number of visits, the number of procedures, and where a lot of those could be mitigated from the primary care side, you simply don't have the time. So to the point, there's almost zero opportunity to even discuss that, Wes.